Well, let's get started. So again, my name is Alfred Wong, Chief Operations Officer here at Cortico. Absolutely thrilled to host today's webinar. We've brought together three companies that Cortico has been working very closely with. These three companies are building tools to help facilitate efficiency for both physicians and frontline staff. I'm pleased to present Shrey from Waive the Wait, Melissa from Pocketpils, Luke from Virtual Hallway. We're going to have an opportunity for them to introduce themselves during the session when they talk about their respective platforms. As for the agenda today, I'm going to keep it a bit short and concise. I want to leave enough time for Q&A for each of the vendors, and I'll then tie it off with a Cortico perspective. I want to do a shout out to Mariana from our team. She spent a considerable effort putting this webinar together, and absolutely thank you for that. So to kick it off, one of the primary reasons why we selected this webinar topic to begin with was because of feedback from physicians. In a recent survey published in June this year, about 1,500 Canadian physicians were surveyed, and the results seem to be in line with some of the issues that we've heard from the community. And in this particular survey, most of the respondents were practicing in an urban or suburb area. Most were either solo or a small physician group. This survey actually had 87 questions covering a wide variety of topics. So if anyone wants to spend time with me and drill down on some of those survey results, please reach out to me or Mariana. I selected a couple of those survey results to frame our discussion today. One of the things that we hear about all the time is daily workload. 80% of Canadian physicians, according to a survey, work up to 60 hours a week. 80% see up to 150 patients per week, which is roughly 25 to 30 patients a day. And 71% spend up to 20 minutes per patient. But despite that, only 30% indicated that they aren't really satisfied with their daily workload. But then when we drill down specifically into administrative work, it's clear that it's a bigger problem, where 56.5% are not all satisfied. And this webinar, we're going to be talking a little bit about different tools that we think we can help to help reduce workload and ultimately increase happiness for both patients as well as physicians. I'm curious what everyone thinks about these stats. If it reflects your experiences, let us know in the comments in the chat. So within administrative tasks, I want to drill down a little bit and talk about patient documentation workflows. 40% of Canadian physicians find documentation to be a major problem. In another survey, and this was published, I think a couple months ago, it was a survey conducted by the Canadian Federation of Independent Businesses, calculated that physicians were spending 10 hours of extra work every single week on unnecessary administrative work. And the key word here is being unnecessary. So it's no wonder why 46.9% of Canadian physicians feel burned out. There's another stat, 43.4% feel stressed out. So altogether, it's 90% of doctors who feel stressed or burned out. It's a pretty substantial number. So with this stat, I wanted to use this, and I think it's a perfect opportunity to showcase our first vendor. We are joined by Shrey, the CEO of Waive the Wait, which offers a host of features powered by AI that automate the administrative task workflow. So now I'm going to pass the screen share off to Shrey. Shrey, the floor is yours.
Perfect. Well, thank you so much, Alfred. Really appreciate the opportunity to present to everybody, and excited to show you what we're working here at Waive the Wait. I just want to confirm you can see my screen.
Yep, clear from our side. Thank you.
Perfect. So Waive the Wait as a company started because of our own personal healthcare horror stories that we saw as individuals within the healthcare administrative realm itself. When I was much younger, my dad got a really bad kitchen accident, and we quickly rushed to our closest hospital, where we ended up waiting over 8 hours before he finally got the help he needed. At which point, we were completely filled with anxiety and overwhelmed at what's going on and what needs to be done to get his care faster. Speaking years later with staff and doctors on the floor, we started to learn more and more that while we were feeling a sense of overwhelmingness, the doctors themselves were overwhelmed, the staff themselves were overwhelmed with the amount of work they had to do on a daily basis. And so with that in mind, we started creating services and systems that help automate the more routine work that happens on an individual level within clinics. So we have two main services that we provide. The first one is the automated task manager, and this deals with the routine EHR workflows that take up way too much time for our clinics. So for example, I'm sure you're used to a screen like this. This is Oscar. And within Oscar, there's a lot of ticklers that are being produced by the doctors to complete really simple tasks, such as booking appointments, letting patients know about the results, etc. If you look at an example of a follow-up process, how it usually works is that, say the doctor receives a lab test result. They'll put a tickler onto Oscar, and the staff member will pick up these tasks and call the patient. If patient picks up, all is well. They'll update the EMR and complete the task. But if the patient doesn't pick up because they're at work or taking care of the kids or for whatever reason not picking up, the staff will then update the EMR, call back again. Update the EMR, call back again. And quickly, what should be a 5-minute task ends up becoming an hour-long spread out across weeks. So we took this 15-step process and made it just 3, where our system will read the tasks as they're coming in, and if appropriate, act upon it. So for example, here, it will schedule a follow-up with a patient for a lab appointment. Within 2 minutes, the system read this, understood the context, and then sent off an email to the patients with a Cortico link to book their appointment. The next day, the system checked and saw the patient did not book the appointment yet. So he sent a recorded phone message with further instructions on what to do and how to book that appointment. The next day, the system checked, saw the appointment was booked, and the task was considered completed with no staff intervention. And that's been really good for the clinics we're working with. And it's not just the follow-ups we're able to process, it's a variety of different tasks. And we can really customize it to whatever the clinic needs specifically. So for example, some of the nephrology clinics or specialist clinics we're working with, they have what is called a no news is good news policy, which is horrifying for the patients, but makes sense because there's so little staff capacity. And what we did with them is now they'll put out a task saying everything normal or results good. And our system will then send off a message to the patient saying, hi, doctors reviewed your labs, everything looks good. No need to book a further consultation. Press 1 to confirm you received this message. And as soon as they press 1, it'll update the EMR and auto-complete that task. This has been really good at reducing the time it takes for a lot of these tasks to be completed. What takes days to work on these tasks, we're able to reduce it because not only are we completing these tasks, but we're also providing the staff the headspace to focus on this much more complex work that needs to be done. The second major system we have is a document triaging system. This deals with the high numbers of faxes that clinics receive on a daily basis. What we did is we created an AI model that's able to identify the patient name, which doctor ordered the document, the type of document itself, is it a radiology report, is it a consult, and then going in further and labeling those secondary labels. So for example, if it is a radiology report, is it an x-ray for the chest or is it an ultrasound for the abdomen? And this, again, has been really good for our clinics. We're able to take care of thousands of faxes every week, saving a lot of staff time so that the staff can focus on a much more complex work they need to deal with on a daily basis. For the implementation process, we will work with the clinics for the first couple of weeks where we'll understand the workflows that are being done there and then seeing how we can automate the tasks themselves and ticklers from beginning to end, as well as see how the faxes deal with the staff and which faxes have to go to which person. As we do that, we'll train our AI models and we'll provide manual verification for the staff and for the clinic for the first few weeks. After the pilots are done, then we can look into production. All of our servers and systems support HIPAA compliance, so we keep all of our servers and databases here in Canada, and we delete all data within 24 hours. We don't want the data, we don't need the data, and so we remove it all within 24 hours. Finally, for the costs, we have the automated task management document triaging service. We charge $250 per clinic for up to 4 providers, and every additional doctor will be about $50 per month. Thank you so much. I'd be happy to answer any specifics.
Thank you, Shrey. For attendees, please use the Q&A or chat function. And Mariana, who is our webinar administrator, she'll bring that up to our attention to answer. Shrey, I have a question for you. I'm not sure if I missed this, but what sort of EMRs do you cover?
So we work with the variety of Oscars as well as with Accuro.
Awesome. And with Accuro, how would if you could walk us through perhaps an onboarding workflow, how many hours or how many days does it usually take for a clinic to start using Waive the Wait?
Yeah, absolutely. So my apology, I think there's a bit of an echo from my side. So with the Accuro, how it works is that we will send off a request to Accuro to integrate with your system and your instance of the EMR. And then once that is done, then the Accuro will provide paperwork to the clinic. Usually that takes approximately a week or 2 weeks. And then after that, they'll provide the database information and login information for the clinic to help implement our system. Once that procedure is done, it takes another 2 weeks to implement the system across the clinic. So about 1 month. However, most of that is waiting for the actual EMR and Accuro to provide us that information.
Thank you, Shrey. If you have, if any attendees think of a question later, please put that in the chat and indicate the company you're asking, for example, for Waive the Wait. And there's a question from the audience.
Yeah, I think, can you hear me?
Yes, we can. Thank you.
Okay, so my question to Shreyas is that my workflow, I thought that there are too many circles in your workflow, what he has shown to me. I am having Cortico, and for example, lab. I have a lab report. I see from the Cortico, I click on that, email comes, report is attached. I see the report. I will say, oh, your blood result is fantastic. You don't need to see me. There is no role of front desk, nothing, no email to be sent. I have done everything from Cortico. Second, if I say, okay, your blood sugar is too high, please book online appointment and patient book online appointment. So your workflow seems to be more tedious to me, why I do need Waive the Wait about the one task you have shown me. Second thing about the faxes. Faxes are tedious process because I know probably your system has a OCR, optical character recognition, by which they find the data. Because there are many things which is a lot of other companies doing through the OCR. The quality of the fax can be poor, which may not be able to read. No? There may be another doctor has written a name of incorrectly. For example, in my clinic, there are two doctors, the one B, the one S. It will not go to my. So do you say that your faxes are automatically put into the patient chart?
So I'll start off with the first question. So it really, again, depends on the workflows you're looking to automate. What we specialize is in multi-step processes. So for example, a lot of clinics use...
Yeah, so what you said that I send a message to my friend as a tickler that, please send a message patient to follow up. Then you read that message and you are automated the email message. No? This is what you are telling me.
That's a part of it, but it could be really expanded.
No, but I don't need that. I just see the patient. I am seeing the blood report. I have a dragon. I click on Cortico link and the report is attached because which is most of the time patient has, oh, my report, please send it. So report is attached. I write a message. Your blood result is excellent. You don't need to see me. There is no one is involved. And I use Dragon, and within a minute, I have done all three tasks which you have shown to me.
So, for example, one more complex task we work with is that, say a doctor is sick in the clinic. Usually what happens is the doctors will either produce a tickler or send a message to their clinic managers, letting them know that they're sick, and then the staff will then call each patient individually, letting them know about the situation, helping them book their next appointments. What some clinics are now being able to do is they'll put out a tickler on Waive the Wait saying, I'm sick, or cancel day. Then what happens is our system will contact every patient that day for that doctor, provide them the Cortico link so they can book their next appointment and inform them about the situation.
Okay, hold on. For example, I'm sick and I have 20 patient appointment on my schedule. And your system will read everybody and will call and inform the doctor is sick, or it will send a text, it will send an email. What it will do?
It depends on the clinic. So which one would you, if you prefer email, we would do that.
No, you have to explain me that how I am a novice and I want to use your system. and maybe some of the patient I don't have email.
Yes.
90% I do have email. So
I know
email
we're a
email
little
will not be reaching to all the people who is reading, who is not reading. So will be a automated robocall will go to the patient. How I didn't understand that part.
Yeah, absolutely. So how we would work is that we would configure and see, we would try the email first. If the email doesn't work, then we'll automatically move to the second communication.
No, I gave you the example that I am on schedule today. Today morning, I got up 9:30. I supposed to start 10 o'clock clinic. And I send my secretary, oh, I'm sick. Now, the only task is that how we need to inform the patient.
So you put the tickler saying I'm sick. The
No,
system.
I'm not saying tickler. I send just message to my front staff that I'm sick. Please cancel all the appointment or reschedule them.
I think like this would be a really fantastic opportunity for Shrey to have a call directly with you, so that because we're a little tight on the agenda for time, and I want to make sure all the vendors get a chance. But yeah, it sounds like a really great discussion. Would you guys be okay with just following up at the end?
Yeah, that's okay. And maybe in a brief, you explain me a little about the facts, how it will save my so many hours.
Yep, absolutely. I'll if you can drop your email in the call or in the chat, I would love to send more information about that.
Okay, I think maybe I would like to talk to you later on that how your system works. I need to be more comfortable before I opt for any system. Yes, I do working with the Cortico for some time. There are every system has a problem. None of the system has 100% proof, 100% for like satisfying. But to me, Cortico at the moment serving a lot of things. So let's have a discussion in person.
Perfect. Sounds good.
Okay then. Bye.
Thank you so much. Shrey, just one more question from the audience. I'll read it for you. Any chance of lower fees for small clinics with lower volume of faxes? Where does the faxes get sorted to? The patient chart or to the physician inboxes? And this is in context of an Accuro environment. Will you provide labeling for the fax as well? Thanks. This is from Kathy.
Yeah, absolutely. So I with Accuro right now, we're in the process of moving the faxes to Accuro, so it's not available yet. So there is some changes going on with Accuro and the way they work to help deal with our fax system. So we will give you more details about that a little bit later. As for lower fees for smaller clinics, that's absolutely something we can do and we can look into, and we'd love to talk more about that in detail.
Great, thank you, Shrey. If you don't mind passing the screen share back to me.
Yes, absolutely.
Now on to prescription workflows. This is an interesting topic because not only does it touch upon physician satisfaction, it also touches upon patient satisfaction. According to a survey done by Canada Health Infoway, 83% of Canadians actually want prescriptions to be sent to the pharmacy without first having to print that paper prescription, but only half of the population has ever used it. In the survey that I mentioned earlier in the start of this webinar, it showed that 74.7% of physicians reported that they did not offer patients the option to request prescription renewals online. And so imagine you have a sick patient who is using Cortico to book a virtual appointment. And now imagine having to write them a prescription and asking them to physically to go to their nearest pharmacy to pick it up. So it's certainly a challenge. This is a perfect opportunity to showcase our next vendor, Melissa. Melissa from Pocketpils, their director of product marketing, and she is here to show how Pocketpils and Cortico can save patients time, as well as talk about the many benefits of using Canada's largest and leading online pharmacy. Melissa, I'll pass the floor to you.
Awesome. Thanks so much, Alfred, and hi, everybody. Great. Can everybody see my screen, Alfred?
Yes.
Awesome. I do hear a bit of an echo, though. Do I sound okay?
Everyone mute your mics, please. Thank you.
So I'm excited to walk you through how together Cortico and Pocketpils can save you and your team valuable admin time, and of course, save precious time for your patients as well. So let's dive right in to see how Pocketpils makes getting your patients their medications a whole lot easier. So Pocketpils is Canada's largest and leading online pharmacy. Our goal is to ensure that your patients can get their pharmacy needs and medications all from the comfort of home by selecting Pocketpils as their pharmacy of choice when they book a doctor's appointment online through Cortico. So here's just some of the ways that Pocketpils and Cortico are working together. We bring the pharmacy right to your patients. They can easily fill their prescriptions online with Pocketpils and have their medications conveniently delivered right to their doorstep. These medications include those that even require temperature control, such as insulin, as we ship it via cold chain. And we can also deliver narcotics and controlled substances in most areas as well. Patients will also never run out of medications with us. We use AI and technology to flag to a patient about 2 or 3 weeks before they're about to run out of medications. And then we work directly with you to get their refills so that they never miss a dose, improving overall adherence. We also enhance patient satisfaction as together we're eliminating both waiting in a clinic and waiting in a pharmacy line. And last but not least, we save your team time as they no longer need to ask the patient for what their pharmacy details are, and they no longer need to do, just a bit more data entry work as well. As Pocketpils pharmacy details will actually already be linked to the patient's profile if they choose to fill through us. So here is just a bit more about Canada's largest and leading online pharmacy. We are the only national pharmacy that offers true coast-to-coast delivery, both from east to west and north to south, including Quebec, Atlantic Canada, and of course, the territories. We also have over 500,000 Canadians on our platform, and that is growing by the day. And as a result of our fulfillment centers across Canada and our in-house fleet team, we can actually offer same-day delivery to the 15 million Canadians who actually live in major metropolitan areas. And that means if your patient sends us a prescription by around 10 or 11 a.m., we can get it to them by the end of day. And we're super proud of our 4.9 Google rating. And after a patient places their second order with us, we actually have an over 90% retention rate, which means if you use us, you'll probably love us. Here's just a bit more about all of the different ways in which we can provide your patients with a frictionless and modern pharmacy experience. So of course, we offer free delivery anywhere in Canada, and we also do that via discreet packaging to ensure privacy. Your patients, neighbors, or what have you will never know that what we shipped the medications is we deliver everything in very plain brown packaging. As I mentioned before, we also have automatic refills, so your patients never miss a dose. And one of my favorite features is live pharmacy support via phone or text. There's been many instances in the past where I've gone to a brick and mortar pharmacy and I've had to talk to my pharmacist about some sensitive information. And now I have the freedom to do that all from the comfort of my home with a pharmacist, one of our pharmacists, via phone or text as well. So let's get into a bit of the logistics in terms of how Cortico and Pocketpils works together. So your patients can choose Pocketpils as their pharmacy when they book their appointment online. This saves you and your office team precious time, as the office admin does not need to set up Pocketpils as a patient's pharmacy of choice in their profile. And also, you as a prescriber, you don't need to ask them which pharmacy the patient they want to use, as they already have pre-selected Pocketpils when they book their doctor's appointment online. And in terms of how we actually deliver prescriptions to your patients, any prescription written by you will then be automatically faxed to Pocketpils via the EMR. Once Pocketpils receives the patient's prescription, we will then send them a text message in order for them to complete their profile, which takes less than a minute. So it's all very seamless and easy. Last but not least, a Pocketpils pharmacist will give the patient a call to ensure that we consult them on their medications. We then fill their order and then deliver it directly to their doorstep. So I probably have the shortest presentation out of everybody, but I will pause there to see if there are any questions that I can answer for everyone.
Thank you, Melissa. Thank you for that presentation. I do want to share a personal story as well. Last time I used Pocketpils, it was exactly in the scenario that you described. I was too sick to even want to go out of the house, and to have the prescription delivered to my door after I think it was same day delivery that I got it in the afternoon after having my appointment in the morning. It was a life-changing experience. It's kind of like when Amazon came out with like a 2-day delivery, and just thinking about how quick products can get to your door. It's just an amazing experience. So I just want to share that, and thank you, Melissa, for that. Any questions for Melissa from the audience?
Thank you, Alfred.
And please, if you think of any questions, don't hesitate to put that into the chat. I'm going to move on to...
There's one in the Q&A section.
Can I hope a little bit, a short discussion? The goal of doctor is a good patient care, and patient need to be well. Whatever we are doing, you people are doing is a good patient care. And I have too much problem with this workflow, because it's great, you deliver at home, it's online, but the problem with the pharmacist, what I found, that a diabetic, 1 year, they're asking me for refill, and he has not done the blood work. If he comes to me, I do the blood work, and I can send prescription. Same this Canada Info Highway, that prescription. I really admired too much to that system by Canada Infotech. I'm forgetting the name. But they created a maze in my OSCA. For example, bisoprolol, epobisoprolol, ACH bisoprolol. And I just need to know that my patient is on 10 long-term medication, but now they are becoming 100 when the pharmacy is requesting me. And there are a host of problems came to know when I did a practical work. So my goal is that when the patient comes to me, he need to do a blood work. He need to check a blood pressure. Most of the people who are sick, they need good care from a physician. And all those things are great that you have app, you have online, but I'm thinking that all these things are resorting to the poor patient care as a doctor.
No, I can absolutely, recognize, some of those concerns. And perhaps I can also recommend that perhaps you and I could meet as well, and I could get that feedback and share it with my team, and we can have a really great open discussion about it, if that sounds good to you.
Yeah, okay. So I think, do you have any doctor who says, oh, what I want to do? Because my goal, so a lot of prescription or that I'm getting a refill things. I said, no more, I need to talk to the pharmacy. I need to see the patient. I need to provide him blood work request. I need to check his blood pressure. If a congestive heart failure, if a blood pressure patient comes to me, everything is great. And in a year, he's admitted to the hospital with a heart failure. So a patient visit to doctor is a must, which we should not forget with all the system.
Absolutely. And we absolutely consider ourselves extensions of you, and even, a part of your team. I think the one thing that you can make sure of is that, as a prescribing doctor, we'll never do a refill unless it's okayed by you, especially in those circumstances. And so I really see us, instead of a blocker, more as a partner for continuity of care.
I do understand, madam. If you are a pharmacist background, no pharmacy asks, did you do a blood work? You are diabetic. They send me a refill things, even by any. They are just looking for their own thing, but the patient, okay, if he's a hypertension patient, would you ask him before sending a refill to the doctor? Did you check your blood pressure? Do you have BP instrument at home? How is your blood pressure? But when patient come to me, I do teach him, oh, you are supposed to take less salt. Your weight is overweight. There are a lot of things being done. So I just say that I appreciate what you people are doing, but the technology part is becoming too hard on my patient care.
Perhaps I can offer a different perspective as well, because one of the areas that we can support clinics is to be able to have them create a what we call a prescription renewal workflow. So if in your case you want to have the patients go through your consultation before being prescribed, we can certainly add that workflow into your online booking workflow, and still have that Pocketpils home delivery service available. And so I think it sort of solves some of the challenges that you raised, where you don't want the patient to go directly to the pharmacist and to renew prescriptions without having that consultation from the family doctor. And we'll be more than happy to take this discussion offline. We have some videos and GIFs that we can certainly walk you through how that might work. Melissa, there was another question from Stanley. The question is, will Pocketpils adapt refills when the patient is stable without a doctor's prescription?
Oh, that is one that I would love to take away with my team and circle back with you guys on, if that's okay. I just want to make sure that I'm providing the accurate answers here.
Yeah, and maybe I can add one note. I know that from our agreements with Pocketpils working together, that that they are in fact always referring the follow-up prescription workflow. So like a refill back to the original family doctor. That was part of the part of our project working together, and that was a really important concern a lot of users raised. So thanks for bringing it up.
Thanks so much, Claire.
I think you might be muted there, Dr. Napier.
Oh, I probably muted myself. I apologize. Now I'd like to introduce you to Luke and John from Virtual Hallway, a platform designed by doctors for doctors with the goal of creating a collaborative community of healthcare providers. Their mission is to enable the swift exchange of clinical knowledge and ultimately benefiting patients by reducing wait lists and improving care. Luke and John, I'll pass it to you now.
Thanks, Alfred. I'll just share my screen here. I want to make sure everybody can see that okay?
Yep, looks good.
Perfect. Great to meet everybody. Thanks for having us to the Cortico team. My name is John. I'm the Director of Business Development here with Virtual Hallway. We're a company based out of Nova Scotia. I'm also joined by Dr. Luke Napier, who is a psychiatrist and one of the co-founders of Virtual Hallway. So he's going to run through just a few slides, and then we'd love to show a quick 2-minute demo as well about Virtual Hallway, how to get signed up, how to use it, that sort of thing, and also how it's integrated with Cortico. So I'll pass it over to Dr. Napier, who will go through a few slides, and thanks again.
Thanks, John, and thanks, Alfred and Clark, and hello to everybody. Yeah, so Virtual Hallway is named as such because it's what we've done is virtualize the corridor consult or the hallway consult. So it's just an easy way for two clinicians to be in touch to communicate about a patient's care. So our mission is really to make the lives of clinicians easier. So it's a network of physicians and nurse practitioners sharing clinical expertise. We stood back from it and realized it's exactly that. It's a network that really easily lets clinicians communicate and optimize their approach to a patient's care. So a primary care provider can request a phone consult in a way that's really organized and scheduled, and it's the calls end up being documented, and then they're billable events. And that's it's a way to get effective advice simply and efficiently. I mean, in my practice, I'm 30 years plus in practice, and it was really common for me to get a message from a family physician, and I would call them back, and you'd play 2 weeks of phone tag, and eventually you'd have a really nice chat. But the inefficiency was just so apparent, or you'd be on call at the hospital and get a non-urgent call from a family doc that just wanted a few minutes of your time. So we just decided to get rid of phone tag and make an efficient way for two docs to be in touch. We were really happy to have the health authority here actually approach us after we had been up and running, and they wanted to have a look at what we were doing, and they did a pilot project from last summer up until Christmas, and their research showed that 84% of the calls that their primary care providers put through our system, the calls were identified by the primary care doc as having prevented them from putting the patient onto a wait list. we thought it was around 50%, the big inefficiency, but even bigger than we thought in the results from the Nova Scotia Health Authority trial. It's been really well received by docs, over 600 family docs using it in the province now, 96% satisfaction rating in that NS Health pilot mentioned. And 98% reported of the docs using it reported that the access to the virtual hallway increases their capacity and comfort to manage care plans in the community. And we see that a lot. Often the doc or the nurse practitioner has an idea about what they want to do. They don't want to wait 6 or 12 months to have the patient see me. They just want to review either a lab report or a medication issue. They have an idea about what they want to do. And then it's just a quick discussion to kind of support them as they go forward. We're really happy to get a lot of great feedback from frontline primary care providers. We started out just in Nova Scotia. It started with just psychiatry, and then it lateralized to include internal medicine and subspecialty medicine practitioners and surgery and pediatrics. So we've really had this amazing growth and uptake. And then PEI wanted to have a look at it. So they signed on in April, a few months after the Nova Scotia Health Authority. So I'll let you folks just have a look at some of the quotes that we're thrilled to receive here. One of the quotes, we actually in discussion with a family doc, he had moved to Nova Scotia from Alberta, didn't know anyone, and he really highlighted, a process that happens where people really feel connected to their peers. He didn't know anybody when he landed here, was making his way in a small practice. And then he realized, wow, he could connect into a group of colleagues really quickly to feel supported. And it's mostly a clinical event, but there's also that, chit chat that happens, and a really nice, the time is tightly defined, and the specialist side is really welcoming of the interactions with the primary care docs. And it's really just a nice collegial process as well as the clinical event. So who can use virtual hallway? So any family physician or nurse practitioner or a specialist in Canada. We realized that it's all about efficiency and in the communication part, but then we realized that it would make sense to set up practice group accounts. So clinic managers can be designated to coordinate the referrals through the virtual hallway platform. Administrative staff can be involved, or the healthcare practitioner themselves can access directly. I have mine on my phone, and it's easily bookmarked and functions, like an app on the phone. So it's really, convenient, and we're really happy. We have in-house developers here, so we're able to fine tune, things as needed week to week. Another part, when we stood back and realized it's clinical knowledge exchange, we thought, we started out just with the conversations. It's a phone conversation rather than an eConsult, which is a text-based. It's a booked phone call. So there's that, live time synchronous communication for clinical knowledge exchange. We realized that CME's lectures made sense as well. So we set up a CME lecture series. So our specialists, roughly twice a month, we run a webinar series, usually on Friday afternoons, and we get them CME accredited. And it's been a really popular part to all this. And then the specialists that present are available for specific case reviews on the virtual hallway platform. So that makes it a nice continuity that happens there. So John, we'll move over into a demo of the platform, and we'd love to sort of show you what we've got here.
So I'm just gonna shift over here to go to our website, which is virtualhallway.ca. This is where you would go to sign up or log into Virtual Hallway. Again, it is able to be accessed through the Cortico plugin and the Oscar EMR, which I think the Cortico team might touch on a bit later. But our website, virtualhallway.ca, this is where you would get registered as a nurse practitioner, family physician, specialist, or as part of a clinic. It only takes about 2 minutes to get signed up, and there's actually no cost to sign up and use Virtual Hallway. It's also where you go to log in every time you'd like to access your account. I'm just going to log in now to a demo account here in Nova Scotia. This is the perspective of a primary care provider looking to book a consult with the specialist on the platform. This is the Nova Scotia platform, so all the specialty areas we see here are specialists in Nova Scotia. You're always consulting within your own province. As Luke mentioned, we started off with psychiatry and internal medicine a couple of years ago, and through some great word of mouth and organic growth, as well as a partnership with the Nova Scotia Health Authority, we're now at around 40 specialty areas. As a primary care provider, if you did want to speak to a psychiatrist on the platform, you would go to the psychiatry area as an example. Once you click that, it will open up the individual psychiatrist available on Virtual Hallway to consult with. You're able to choose a specific specialist, view a short bio, as well as any areas of expertise they might promote on Virtual Hallway. You are also able to hit the Any Specialist button, and that will bring up the aggregate availability of all the psychiatrists on Virtual Hallway. So you really see the more buy-in we get in each specialty area, in each province. It really does open up availability for primary care providers to choose from. Here in Nova Scotia, we have psychiatry available 6 days a week to consult with, which is pretty great to see. I'm just going to go back a step and go down to a specific specialist to book with. We'll see once we click Dr. McDonald and into her schedule that she's available Monday, Tuesdays, Thursdays, and Fridays on Virtual Hallway. So we're going to book for tomorrow. We'll see she's got 2 time slots available tomorrow, 8:40 and 8:50 a.m. Once we click onto one of those, that will save our spot with Dr. McDonald and open up the consult request form. This is the request form that a referring provider would send to the specialist, preloaded with the patient information, health card number for billing purposes, the consult question, and any other clinical information that the specialist would like to receive. So it does vary from specialty area to specialty area. Psychiatry is one of the shorter ones, while you'll see other internal medicine specialists in dermatology, for example, ask for a file upload or a photo input. The consult question, this is where the referring provider is looking for some guidance about the case. So this is where, as Luke mentioned, it really is a hallway consultation revolving around that question, whether it's about medication or an abnormal lab result or such, that would go into this box here. That's submitted to the specialist and will go into both of their calendars, which is saved here and can also be integrated with other types of calendars that they might be using as well. We'll see that the call is in the calendar and 15 minutes prior to the call time. So tomorrow at, we'll say 8:15 a.m., both sides will receive a text message, remind them of the upcoming phone call. The specialist will be preloaded with the referring provider's cell phone number in that text message. They'll have a call, a 5 or 10 minute call about the case. Following that call, in the My Consults tab, the documentation for the consult is warehoused. So we'll log in here and we'll see our request to Dr. McDonald, which is an example of the psychiatry question here, and then the response as well from the psychiatrist. And this is after the call. So this is stored safely and securely in Virtual Hallway. It can also be downloaded as an encrypted PDF or faxed to an EMR or an office. So we're seeing a lot of providers connect their EMR fax to Virtual Hallway. That way, once a specialist submits the response, it gets automatically faxed over to the EMR without having to log back in. And that is really Virtual Hallway in the functionality standpoint. Luke also touched on the CME lecture series. He mentioned that we're currently available in Nova Scotia, Prince Edward Island, and Ontario. That being said, we are looking to get up and running in other provinces, including British Columbia, Alberta, Saskatchewan, in the coming months. I think Luke did touch a little bit about the CME lecture series. It's a great way to kind of stay involved with Virtual Hallway if we're not up and running in your province. This is where you would go to register for upcoming lectures or view the bank of stored lectures on Virtual Hallway, which are available to claim a CME credit as well, and kind of stay involved that way. I'll kind of take a break there, and we're happy to answer any questions. And Luke as well as does a lot of consulting on the platform, so might have more to add.
Yeah, thanks.
Oh, sorry, go ahead.
Oh, no, please click.
Oh, when you're ready, Luke, if you guys want, I can show just like, you showed kind of a long form there that is a bit of work to fill out. So one of the projects we did together with you guys was to pull that information in from the EMR automatically with one click. So I have that set up to showcase it.
Be great, Clark.
When you're ready.
That'd be great, thanks.
Okay, and I do have to go in a little bit, so thanks for letting me jump in. Can you see my screen?
Yep.
So there's a bunch going on here. I have Oscar on the right, but I've got the Cortico plugin is loading Virtual Hallway because this clinic's using it. And I'm able to just click consult a specialist, book a phone consult, and then I'm going to get Virtual Hallway opening automatically. And once I choose my specialist here, it's going to fill in my patient that I had selected here over in the EMR. So I have a lot less data to fill in because it's been, I was able to launch it from there and have that patient in context. So that's just like a quick little thing to add on to your presentation. I'll give you back the floor.
That's fantastic. Thanks, Clark. I'm a little embarrassed to say I've never actually seen it flow through like that. That's amazing. Wow. Very cool.
It's fairly new, but we're pretty excited about it, and yeah, pretty excited with what Cortico has been able to help us with, and hopefully it does make it just that much easier to use in your clinics. That was it for us. So we're happy to take any questions or address any questions or comments.
Thanks. I think there is a question from the audience. Marion, if you wouldn't mind.
Okay, so first of all, I wish everybody is doing some effort to improve the help to the doctors. We do have a company called Ocean, and the government also funded for eConsult. So I'm thinking that, does it work? The problem is that specialists are so busy here, and the biggest problem, so I'm not 100% sure that do we have 2-3 competitors for the same task to like have a messaging or send them consult, like, is it a good idea? Because I would need a one platform which can communicate with my specialist. That is one thing. So eConsult has been funded for family doctor. We don't pay, but I heard that specialists need to pay. The problem I found in Ontario, because I'm in Ontario, that there is a big waiting time, and we don't know which doctor has how much waiting time. I would be happy to have a virtual hallway if all the doctors are joining with them. And I'm not 100% sure when you are like booking an appointment with the specialist, does it go directly to their EMR or somebody has to have a like put in their EMR? Can you reply me that?
Great questions. So it is similar to the Ocean eConsult platform in Ontario, rather than this is a synchronous phone call happening, except instead of an asynchronous text exchange for the clinical information. I'll let Luke touch on that a little bit, but just to jump ahead, your question about scheduling an EMR, our team does work with specialist departments to make that happen on a case-by-case basis. So it is certainly that's something that's possible. There's also the ability to have a practice group account where an administrative staff can handle those appointments. So that is possible in a couple of different ways. And I'll let Luke touch a little bit more on the eConsult comparison.
Yeah. So yeah, my understanding is Ocean does e-referrals where the patient is referred to see the specialist, and then e-consults, which is, as John mentioned, it's a text-based question that goes into a bank, and then a specialist will pick up the question and respond with a text-based answer, but the two physicians don't have any kind of a live communication. Ours is, as mentioned, there's a text question that comes in from primary care after they've selected that exact time that they want to receive a call from the specialist. The specialist reviews the note, the question that's been posed. Then the call happens. They work it out in a 5 or 10 minute chat, and then the specialist ends up responding with a summary note of the discussion. So it's like an e-consult with a live phone call in between. Another differentiator, that's a big one, just that live call, because it allows for follow-up questions. For me, it's the clinical stuff, but then there's that collegial stuff that happens. We're also disconnected these days. It's a really warm, nice interaction, and primary care folks, really happy to have the quick access. So it's different that way in terms of a live call versus an asynchronous text-based communication. It also allows for longitudinal contact with that same specialist, as opposed to that anonymous kind of banked or the question gets launched into a pool, and then it's selected. So that that asynchronous approach doesn't allow for that longitudinal re-referral to the same person. We do the documentation too, where the documentation ends up getting it's available through the platform. For years I was doing these on the fly, and I would never, it was the phone tag was a pain. I would never write down what was said, so there was medical legal risk because of no documentation, and I had no idea there was fee codes that would allow both sides to get paid. So we take care of those three things: the scheduling, the documentation, and the compensation.
Okay, still my question is very simple, that how many people will adopt, because we are working for last 3 years with eConsult, and when I want to refer to the psychiatrist, there is few specialists available. Most people are not adopting. So you need to have 100% of consultant, specialist, and 100% physician. And how it will show me the wait time, because either a doctor need to input that, oh, my waiting is 15 days or 10 days, or their EMR, you directly take a analytic data and then you put it, because I know it's getting too complex. I'm using eConsult for last 3 years. It's funded, it's free for me, but I find that waiting time, they need to make it, 5 days. If they forget 5 days, it will remain 5 days. It might be 15 days. So this is a little bit at the moment. I'm not sure virtual hallway can do a better job than other place. And the funding model, how you will be paid, that is a long discussion. I would not like to go. Anyway, thanks for all the things, but I'm still not sure that how it will succeed in Ontario at least. I'm not sure about Nova Scotia. It may be doing great. In my time, I did work in Nova Scotia. There was a Nightingale, and I can see at least all the specialists. I could not see the waiting time that time. But here, what I'm saying that 100% specialist has to adopt your system, or maybe 80%, 60% more doctor need to adopt your system, then it will work. Because if you say XYZ doctor, but he's not on virtual hallway, I will not be able to contact him.
So our system,
doctor, there's a long way to go for you. I can say you, because I have a lot of experience here. I did work 5 years in Nova Scotia, and I'm here for 10 to 12 years in Ontario. And I'm a very digital person. You will not.
Thank you, Dr. Patel. Thank you for the question. I'm just cognizant of time.
I'm keeping short, so I'm not going to talk too much. And let's hope that another person can talk to you.
Yeah, thank you so much. Dr. Napier, I think you indirectly addressed the next question from the audience. Kathy asked, any costs associated with the use of virtual hallway?
It's free to use for primary care providers. Yeah.
Great. Awesome. Thank you so much for answering that question. I'm going to make a couple of closing words. Just bear with me. So thank you all so much. I wanted to say a couple of words looking to tie these vendors together under a Cortico's perspective. As a technology company, we're pretty biased when we suggest to healthcare providers to adopt technology. But, the reality is that we see some amazing outcomes in terms of patient happiness and physician satisfaction. Since Cortico started in 2020, making our product available to other clinics, we've cumulatively helped over 1.8 million patient appointments. And now on a monthly basis, we're automating over 500,000 admin tasks. Every tool that we build is a result of feedback from you, the community, on what you want to see in your day-to-day workflow. So your feedback on how we're doing, how Cortico is doing, how our vendors are doing, this feedback is really critical to help us understand what to build next. So that's it for this webinar. I thank everyone who has joined us tonight. Our next webinar event is on November 22nd, where you will discover tips on how MOAs can help to reduce burnout. Thank you so much, and keep in mind, we will also be circulating a recording of this. Thank you all very much.